Hey everybody. So the more and more that I work with patients who are in chronic pain, and I'm talking, pain that's been going on for 5, 10, sometimes, even 40, 50 years. The more I encounter situations where patients have emotions associated with their pain, especially when we're doing procedures. And a lot of the times we can't predict that patients are going to have this response, or we're not able to determine beforehand if we need to do anything to try and mitigate or augment until it happens. And this is something that I'm going to be digging into more in the next few months and things like that, just because I think it's something that I need some better tools to address. And so to walk you through kind of what happens is our bodies can hold on to emotions in different areas, in our fascia, in different connective tissues like the muscle, tendon, things like that. And we become unaware of this. And to clarify, these emotions are generally associated with the initial trauma or incident, or an emotional trauma that occurred around the time of that injury. And those are kind of the emotions that get put there, whether that's fear or sadness or anger. And when we go in with an injection therapy, the needle and the solution wakes the body and the mind up to those emotions. And sometimes we have a beautiful healing response, and patients are finally able to slowly, acknowledge and work through those feelings. Other times, it's just as if the patient is reliving those sensations, and they're not able to begin to process forward, and it is just an emotion, and they can't do anything about it. And so, I don't know how I'm going to fully approach this at this point. I do have some theories on some different things I can do, just based on my understanding of how different practitioners approach those emotions on their own. But I just kind of wanted to fill you guys in on just some of those thoughts that I'm having surrounding, when we have these situations where we store our emotions inside of our body in certain injured areas. And one of the other interesting things that actually occurred recently is I suspect that in the patients where we get this response, if they are not able to fully work through those emotions, I think those patients have a harder time healing, because a component of their healing process needs to be these emotions that are associated with those tissue structures and areas. And for some of you watching this, may be complete woo-woo and all that kind of stuff, but man, I tell you, when you put a needle into someone's spine or someone's knee, and all of a sudden they are detailing them reliving certain emotions, not just the fear of that injection, but reliving the same emotions that they had from their initial injury, whether it was a huge traumatic thing like a car accident, or just an emotional thing like a breakup that around that time. Man, I tell you, it is a very, very real thing. So that's just kind of my beginning thoughts on this as I start to work through how I'm going to start approaching and thinking and addressing. All right. Hope you have a good day.